Welcome to Health Update Extra, Rockford Health System news and information you can use to make informed health decisions. In this segment of Health Update Extra, Dr. Juliet Ugarte Hopkins, a pediatric hospitalist at Rockford Memorial Hospital, discusses the severity of illness associated with H1N1 flu virus in children. She will also talk about the signs and symptoms you, as a parent, should look for in your child that require a call to your doctor, as well as signs and symptoms which require immediate evaluation by a physician. How severe is illness associated with H1N1 flu virus in children?
Actually, this is something that's caused a great deal of confusion with many parents because we hear in the media all the time how there's many children who are dying of this or becoming severely ill. But in reality, every child who has a runny or stuffy nose doesn't need to be brought to their doctor to be evaluated. There are many children who become significantly ill. They do need to be in the hospital. Many have gone to the intensive care unit and many have even died. However, there's also a whole other group of children who have symptoms that are very similar to a common cold, such as a fever, runny, stuffy nose, a little bit of a cough, but these things pass and that they don't need evaluation by a doctor.
What are the signs and symptoms which require a call to my child's doctor?
Many of the signs and symptoms, as I said before, are very, very similar to your common cold. Children can have a fever, body aches, overall tiredness, a runny, stuffy nose, and a mild cough. Sometimes the cough is a little more severe than others, but many times these are the only symptoms. However, there are others that can develop which parents need to be aware of that might be a sign that they need to bring their children to a physician.
What are other important signs and symptoms that may indicate my child has the H1N1 virus?
Some of the signs and symptoms that parents should look for, which would indicate that they do need to at least contact their physician or actually bring them to a clinic or medical attention, would be signs especially of respiratory distress. Now, these are things that can be seen by anybody, whether it's a daycare provider or a babysitter or the parents. And they vary depending on age, but all of them essentially are similar in that the child is actually having a difficult time breathing, not that they're just miserable with a runny nose or have a little bit of a cough. In an infant or younger children especially, you'll see one of the things you'll see is called nasal flaring, and that's where you see this area of their nose here actually go in and out as they're trying to breathe. Another is called retractions, which is if you look at your child's chest when you're pulling their shirt up, you can see that the skin in between their ribs is actually sucking in every time that they take a breath. Another concerning symptom is called tracheal tugging, and that is if you look at the hollow of their neck and you see that that's sucking in with each breath, that also would be of significant concern. Now, one thing to remember is that a parent can see all of these things in a child even if they're healthy, but if they're throwing a tantrum or if they've been playing really hard or if they're just crying really hard for whatever reason. So it's important to be aware that that possibility of a child exhibiting these symptoms for just a few minutes, even if there's nothing wrong with them, is possible. But if you see this in your child for a prolonged period of time, more than 10, 15, 20 minutes, or especially if they're very calm, just lying on the couch and aren't being active, those would be signs of concern. Other things that are concerning not related to the respiratory system or the way that children breathe is with eating, especially in babies. A lot of times when babies have a very stuffy nose, they're not able to eat from a bottle or breastfeed like they normally do. So in those instances, these babies have a significant decline in the amount that they eat, which then can lead to significant dehydration, which can be very dangerous in an infant or a young child. So if the parent notices that their child is drinking a whole lot less than they normally do, especially if they see that the baby's not making as many wet diapers as they normally do, that would be another reason to contact your physician.
When should I be concerned about a fever?
One thing that many parents are concerned about across the board, not just with H1N1 or any other influenza, is fevers. One part of H1N1 and seasonal influenza is that children do tend to have pretty high fevers. Sometimes they can be 103, 104, or even higher. This is something that parents worry a great deal about, and sometimes for good reason, but many times this is not something that parents need to feel is the end of the world as far as their child is concerned. If your child only has a fever in low grade, meaning it's less than 102, That in itself, if your child is not demonstrating any of the other concerning symptoms that I've already talked about, isn't something that would require you to go immediately to the doctor. But if you have an infant who is younger than 2 months of age, if they do have a temperature over 100.4, that is something that needs to be brought to medical attention right away, simply because of the age of the child. Other older children having fever who need to be brought to the doctor include children who have fever higher than 104, or children who have fever for more than 4 days in a row. Those may be indications that something more significant is going on with the child's health, and they should be brought to medical attention. Some signs and symptoms that you may see in your child that would require immediate consultation by a physician, no matter what, include the following. 1, if your child is not waking up, whether it's from a nap in the day or whether it's waking up in the morning after a night of rest. If you cannot wake your child, that's cause for alarm. 2, if your child will wake up but is not really as interactive as they normally are. If they're not responding to you, not just that they're not as playful as they normally are, but if they're truly just kind of lying on the couch or lying in bed and not really responding to you, that also would be concerning. As far as breathing goes, if they're breathing very fast, very heavy, or in the opposite scenario, they're breathing shallowly and not taking normal breaths like you would expect them to, or if they had especially a very pale or grayish or bluish color to their skin, that would be a cause for immediate alarm, and they should be brought to medical attention immediately as well. There's also rashes that need to be brought to a doctor's attention if they are associated with fever. Now, many children who have fever will develop a very light pinkish rash all over their body, and that's not something that people need to be too concerned about in and of itself. But if your child has a fever and has a rash which is a reddish or purplish color, then that should be considered an emergency.
Health Update Extra is produced by Rockford Health System. Become a subscriber to the Rockford Health System YouTube channel or become a fan on the Rockford Health System Facebook page, and you'll receive notices on future Health Update Extra topics.